Welcome back. This is a KTN News special edition as we focus on a very important subject that touches on protection of children in these uncertain times of the coronavirus pandemic. Just before the break, we were engaging with our panelists just to pick their assessment of where we are as a country, and indeed a lot of gaps still ahead. But I'd like us to pause for a minute and take a look at some interesting statistics that we've been able to put together for you. Then we shall be getting some reactions from our panelists. Well, very grim statistics from a gender-based violence survey conducted by the government. About 1 in every 2 children in Kenya experience violence. 4 in 10 females and 5 in 10 males experience physical violence in childhood. It does not stop there. Well, 3 in 40 females and 2 in 40 males experienced emotional violence in childhood. Well, 3 out of 20 females and 1 in 20 males experience sexual violence in childhood. Well, let me take another slide before we can get some reactions from our panelists. Well, about half of children in Kenya have witnessed violence in the home or community. 1 in 2 females and 1 in 2 males witnessed violence in the home in childhood. Well, I'd like to put the same to my panelists, and let me begin by engaging Mr. Chege. Very sharp statistics that point to a serious issue in society. And when you consider what has been happening under the COVID-19 pandemic, of course, some families are straining owing to the economic turbulence that did hit the country. Perhaps, would you say these statistics could be much more than what we have?
I think, again, what you have presented, what is happening, but I can say the situation could even be worse because, in addition to the statistics that you have quoted, I can give you another statistic that was reported by the Minister of Health last week. They mentioned that over 200,000 children and girls below the age of 10 missed out on key immunization between January and June this year. So that can tell you the impact on the health and future of these children. And to me, what I would want to add here again is that COVID-19 has actually deepened poverty, which has gone along in widening the inequalities we have in this country, and even globally, where you see that children from the most vulnerable households are the most affected, because these are the households that have lost jobs, their parents have lost jobs, or their caregivers have lost jobs, or the business they are doing are not performing. Remember, in the first few months of COVID-19, some marketplaces and markets were closed down, and most of the children that you deal with are from most vulnerable households. Those children have borne the brunt of the COVID-19. So the statistics actually can be, I can say they are not reflective of the actual. The situation is getting worse, especially if we are not going to address the issue of poverty levels. Let me give you another statistics again.
Carry on.
UNICEF has indicated in one of their reports that if poverty increases by just 1%, we are going to see an increase in child labor of 0.7%. So you can imagine the magnitude of that in Kenya. For example, we're talking of 15 million children who are out of school. So if 0.7% of them are subjected to child labor, what does that mean? So I think the statistics are good, and I think they are good to us and policymakers to be able to see how do we address this thing before it becomes a big challenge. Remember, children have only one chance to grow. So if we don't prioritize protect them from the pandemic,
yes,
then we're still talking over their future being doomed. So I think I'm happy that these statistics are out there, and they're now trying to tell us what is happening. And we need, as development workers, as policy makers, to see how do we prioritize interventions addressing children's issues to do with children's needs. Because when you look at, again, what is happening, most of the things addressing other ages, adult economy that looking at employment, but we have kind of not fully prioritized children and their needs. So I'm happy that the statistics are there. They should be able to help us come up with, interventions, policies, and other guidelines that would allow us to address this situation before it goes out of hand. Because if we don't have these children, then our future as a nation is also compromised.
All right. Thank you, Mr. Chege. Let me bring in Madam Lillian, just to also pick your thoughts, especially looking at the issue of abuse of children. At the same time, we've seen the government saying all teenagers who end up being pregnant, the government will cater for the costs when it comes to delivery in hospitals. Well, what does this symbolize for our society, and is it an alarming place to be?
It's an alarming place to be when you see the number of teenage pregnancies increasing the way that it is, because these are children. And ideally, we'd want to see them in school. We'd want to see them protected. They need to get an education so that they can also have their own sources of livelihood. And education really is the best way that they can equip themselves towards that. So, getting pregnant as a teenager, you become a mother at a young age, so that also then perpetrates, if you like, the poverty cycle within the family, because when that child now also has to look after a baby, they are not prepared or well equipped. So I believe that besides the problems of poverty, we really also need to challenge social norms so that violence against children is considered unacceptable. Because you'll find that, I think out of some of the statistics that you read, what also came out in the survey report that was produced by government was that there were about 12.5% of young women who had experienced sexual violence as a child, and they never sought help. And there are quite a number of women also who consider that being abused is not a problem, and even also many children that think that violence is to be tolerated because of the environment that they themselves would have grown up in. They experience violence, they see their fathers beating up their mothers. So growing up in that environment, they start accepting that it's okay to be violent against women, to be violent against children. So we really need to challenge those social norms that allow for violence to continue to be perpetrated and to be considered acceptable. It should be made known to everybody that it is unacceptable. And women should be sensitized, and children, as well as awareness raising, to make them understand that there's a toll-free number, especially for the child helpline, 116, for them to report these cases, also report perpetrators to the police, and the police also held accountable to make sure that the perpetrators are brought to book. So cultural norms, where perpetrators sometimes are protected, all those are things that need to be challenged, and we can galvanize all our efforts through these community-based approaches that the various agencies and organizations are working through, the engagements with government, the engagement with law enforcement agencies. We can all work together to make sure that we challenge some of these social norms and make sure that children are protected. So I really think that it's important that culture, social norms and behaviors, even using the church and other faith-based organizations, to make sure that messages are relayed to families, to communities, to make sure that we do not accept such behavior in our communities. I think that's another important thing that we need to do and continuously work on, to raise that awareness and sensitization, to make sure that people know what to do when faced with such situations. So there are various campaigns that are ongoing, but we need to really create a movement at community level, especially to make sure that child protection issues are not accepted at all, and people know how to report and how to treat these issues as they come up.
All right. Let me also get your thoughts, Madam Chege, especially around how do we restart government protection systems? Because clearly, with all the cases we are seeing, there seems to be a total collapse in the system.
per se, but there's a significant weakening of the system because of the situation that we are in as a country. Just like maybe a few other systems have been affected by the COVID and diversion of resources towards making sure that where we are with the lowering number of infections. I think one of the things that I would want to say is that all the partners in the Child Protection Center needs to rally behind what the government is doing to keep the system going. You realize that, just like I had said, and I think Lydian has also mentioned, the toll-free lines that are taking care of issues of child protection reporting and GBV reporting, they are overwhelmed. And there is the report from the National Gender and Equality Commission last week said that in 1 month, the number 1195 received a total of more than 4,000 calls on gender-based violence, and a significant number of those were by girls between the age of 15 and 19. Who are reporting and seeking help and counseling about issues of sexual gender-based violence. I think if all the partners to the government can rally behind strengthening such systems, we will see a significant improvement in the way the government is running the child protection system. If we can be able to support with the reporting, because like Lydian has said, about 46% of the women and girls who are interviewed in the VAC report 2019, they said that they did not report the cases of sexual violence because, one, they thought it was normal, but also because they are afraid of the process of reporting and the kind of systems that they have to go through. There is a significant fear of the police, and I think the police have come out to say now they have even a center for child protection, they have the polycare, they have a toll-free line. If we can all sensitize the public about the services that are available to the government, through the government, I think it will be very important for curbing some of the things that are happening to the children. And the other thing is just facilitating the survivors to get to the support that they need. You realize that a lot of sexual violence and physical violence and other forms of violence against children will occur right in the villages, and they don't even have bus fare to get to the nearest hospital, to the nearest police station, to the nearest Department of Children's Services so that they can report. I think for us is to facilitate. The systems are there.
All right.
They could have been weakened, but we can contribute to strengthening them so that we can continue protecting the children.
You.
And the opportunity is there. I believe that the government is very open to support from the partners.
All right. Well, ladies and gentlemen, we are coming to the tail end of our discussion, and I'd like to get your closing thoughts, especially when it comes to the parents, because after all is said and done, it boils down to the home, where we can see a change in culture, a change in attitude that has to trickle down. By this, I'm talking about positive parenting programs for parents in these times of COVID. I'd like to get your closing thoughts on this, Mr. Chege, in just under 30 seconds.
I think it is important because at the end of the day, a child will go to school and come back home. Home is the best place to be. And I think it's important that our parents that are sensitized and provided with some training, if need be, for them to appreciate. Because as we have seen some situation where you find young mothers or young fathers, they just not they had planned, and they ended up being parents. So how do we prepare such homes or such couples to be able to take care of their children? I think we have an obligation as organizations to make sure that we are able to bring support such couples or such households, orientation, support. But the other critical thing that also needs to go with that is this economic strengthening, because some of these things, some of those people are jobless. They have skills, but they don't have anything to do. In order to ensure that whatever they are getting, even the orientation, the skills they are getting, parenting skills and responsive caregiving, we also need to help them to have a source of livelihood so that they can now be able to support their families.
Thank you, Mr.
Even
Chege.
with the skills and all that, and without sources of livelihood, I think we'll not be doing much.
All right. And Madam Lillian, your closing thoughts as well.
Address mothers, fathers, caregivers out there to just encourage them that, you know, child violence begins in the home. A child's first experience of violence is often at home, and we've seen that with COVID-19, or in their community, where they have a right to feel safe, to feel protected. So I'd really like to appeal to mothers, to fathers, to caregivers, to my brothers and sisters out there, that let's come together. Let's create an environment that is safe for our children. Our children are the future of Kenya. So we all have a collective and individual responsibility to make sure that we create that environment that is conducive for them to not only survive this COVID-19 pandemic and its aftershocks, but to thrive. And you can count on World Vision Kenya as a key member of the Joining Forces Alliance, coming together to partner with you at community level, at household level, to help strengthen our community mechanisms for child protection. And we commit also as GFA to work with the government of Kenya to make sure that we play our part and play our role in ensuring that our children in Kenya are well taken care of and they are protected and cared for.
All right. Finally, Madam Chege, we are literally out of time. Keep your comments very brief.
Okay, thank you so much. I think for me what I would want to say is that values are not taught in school. They are taught at home, and parents need to understand that. It's not the responsibility of the teacher to tell your girl or your boy that there is something like sexuality and you need to understand yourself and you need to protect yourself and you need to understand how to relate with the opposite sex. That is taught at home. It's up to the parents to provide pads. Girls don't have to go out to look for pads from people who harm them so that they can have pads. And it is not very good when the statistics say that 23% of the boys and 31% of the girls are the only ones reporting that their parents use positive discipline. So like Madam Lillian has said, I think it's the responsibility of the partners in child protection just to make sure that this message gets to the parents and they get the support that they need for skillful parenting and positive discipline. That way we can protect the children right from home.
Fantastic. Thank you so much, ladies and gentlemen, for making time for this very important discussion. Well, we've been talking about a very interesting topic around child protection in the country, and the clarion call really is to parents to ensure that they exercise skillful parenting and at the end of it all ensure that they respect the rights of the children because they are humans as well. Well, it is at this point where we bring this conversation to a close, and of course many thanks to all those who facilitated this production, and we say bye-bye from here and see you next time. My name is Abe Gina. Keep safe and continue viewing KTN News.